Hi everyone, my name is Steve Flores, and today I will be discussing something that affects the lives of every American. Um, Americans who are uninsured are at higher risk of dying prematurely, and considering the epidemic that we're living through right now with the coronavirus, people who do not have health coverage or who are underinsured are not prepared to get infected by this virus. People were already dying prematurely before because of lack of adequate health care. So the importance for healthcare now is higher more than ever. Um, the way our current healthcare system is set up, most people get their healthcare through their employer. And considering that over 6 million people applied for unemployment last week, that's telling us that at the middle of a health epidemic, millions of people are losing their health coverage. And that's part of uh, exactly why our current healthcare system is flawed. There's a lot of financial barriers to the current system. Again, even for those who are insured, they may not find it easy or accessible to seek the medical treatment that they need. And the root cause to this, in my opinion, is the fact that healthcare as it is today is a for profit system. So, in order to make tons of money, a lot of these healthcare companies want to make sure that healthcare stays exactly the way it is. So, what I am proposing today is that we support and get behind Bernie Sanders' Medicare for All bill. This bill would save money, save on resources, and save the lives of many, many Americans. There was a study done by the Koch brothers that found that switching to Medicare for All would save the country $600 billion a year in healthcare costs. There's tons of waste and tons of money, resources that are wasted in administrative costs in our current system. Switching to Medicare for All is a more organized system. It eliminates all the different plans and companies that you get to choose from. All of that confusion is gone when the single payer is the US government. And that's why I propose that the US enact Medicare for All. There's quite a few harms that come with our current healthcare system as it stands, and I'll outline some of them here. The current system causes death and suffering, and you heard that right. A Commonwealth Fund study found that 84,000 Americans die every year due to preventable deaths. So that means these deaths could have been prevented had they sought healthcare when they needed it. But the U.S. ranks last in preventable healthcare. In preventable deaths among other major industrialized nations. And the reason for that is the high costs, the high co-payments that a lot of the current health coverage comes with. People do not seek medical attention when they need it, and that just snowballs into greater issues. Another harm is that the status quo makes healthcare inaccessible. Like I previously stated, the healthcare corporations, healthcare industry's focus is not necessarily to provide healthcare, but rather to make tons of money every year. So when asked, 45% of uninsured adults in the US stated that the reason they don't have health coverage is because of the cost. Over 500,000 families in the US go to bankruptcy every year. That totals 60% of all bankruptcies in the country. And those are due to medically related expenses. So over 500,000 people, the number one leading reason for bankruptcies in this country is due to medically related expenses. This interferes with the lives of hardworking Americans. People who have a second job may have to get a third job. People are looking to take out loans, get heavily in debt, all because they got sick, they needed medical help, they needed mental help. These are not reasons that people should be going bankrupt. So the inherent problem here is that the healthcare system as it is a for-profit system. That is the inherent problem. There have been efforts in the past that were made to pass a single-payer universal system, but these healthcare corporations, these health pharmaceutical companies, they have tons of money, tons of power, and tons of influence, especially on politicians. So they will make sure they stop at nothing to keep the status quo. That keeps tons of money flowing into these corporations year after year. So although providing healthcare may be a more humane thing to do, again, their focus is to make money. And that is exactly the problem with the current healthcare system. And so you may be thinking, this is great. This makes sense. How do we make this happen? There is a Medicare for All bill out there, and these are the mandates that would need to take place in order for Medicare to all to be successfully enacted. So 1, Congress needs to pass Medicare for All. 2, we eliminate co-payments and deductibles, and the single payer again is the US government. By doing that, you eliminate all the administrative costs of all the other plans, and there's just one single payer, which is the government, and that will save over $600 billion every year in administrative costs. It would keep the system a lot more organized. 3 is the enforcement would be done by the government. 4, money to fund this. So how do you pay for it? You tax the middle class, you tax corporations, you tax the wealthy. There's also money that is allocated every year to federal programs that provide healthcare. There's Medicare, Medicaid, and other programs. All that money, you just reallocate it to Medicare for All along with the taxpayer money. And although there will be a slight increase in taxes for the middle class, overall, your spending will be less for Medicare, for healthcare. And there is a 4-year transition period. So Medicare is a current system. We were not starting from scratch. We're getting an existing popular system that works perfectly fine now and just expanding it. It's a 4-year transition period. The first year, you take the current eligibility age of Medicare, which is 65, and you lower it to 55. So anyone 55 and older can qualify for Medicare. Second year, you lower that again 10 more years. So you're down to 45 and older, you can sign up for Medicare. Third year, it's 35 and older. And then the fourth year, everyone else under 35 years of age can then be eligible for Medicare for All. The enforcement, again, would come from the US government. As I stated, the main way to get healthcare now is through your employer. That will no longer be a thing. Your employer will not be able to take money from your paycheck for healthcare because your healthcare will come from the government. So your employer will not be allowed to provide healthcare for you when you already are getting healthcare through the government. So you won't have like double coverage and have to pay for something you're not going to use. The funding, again, comes from taxes, the government's allocated funds for healthcare services. All of that would fund Medicare for All. And the timeline would be to start immediately with a 4-year transition period. So the solvency, I've laid out some of these issues that come with our current healthcare system. And when we enact Medicare for All, you would lower that preventable deaths from 84,000 a year, drastically lower that. When everyone has healthcare, everyone has access to coverage, then the 84,000 preventable deaths may then be preventable, or a vast amount of them. By eliminating co-payments and deductibles, you also eliminate that burden of people having to go bankrupt due to medically related expenses. That will free up the lives of tons of people. They won't have to get themselves into debt. They won't have to empty their savings accounts. People will be able to live their lives and, maybe spend that money, buy a house. All of this will keep the economy and society flourishing. It just overall would improve the ranking of the US healthcare system, which at the moment does not rank too well. From the other harm I stated, there's 27.5 people uninsured. So when you provide Medicare for all, everyone is insured. So you bring that number from 27.5 million people to down to zero. There's no surprise bills, no co-payments, no deductibles, no fear of having to turn to bankruptcy for a lot of families. And again, by providing healthcare to all the people, we will be improving the lives, or improving the quality of life that's expected here in the US. Society would flourish with happier, healthier people. The advantages, in addition to guaranteeing healthcare to everyone, healthcare outcomes will improve. At the moment, a lot of other countries have longer life expectancies than the US, and a lot of those countries are countries that provide healthcare to all their people. So that would improve too. Our life expectancy would raise up. The US at the moment, unfortunately, has one of the highest infant mortality rates of major industrialized nations. And think about that. Children die in the US more than other major countries. The US, kids should not be dying in the US because of lack of healthcare. That is a real problem. Medicare for All would provide dental coverage, vision, home health care, mental health care, and in doing so, you're also creating a space for jobs. We're going to need a lot of these healthcare providers, a lot of these healthcare workers. So it's giving back to the economy. It's creating jobs to have these health care services. Again, the current system pockets a lot of this money, and it's not necessarily giving back and expanding services. So Medicare for All takes away, it removes the for-profit driven need, and it focuses on providing healthcare. So I've laid out a lot of the issues that come with the current system. I've provided a lot of the issues that come with the current system, and I think what we're going through today is a prime example of why our current system is flawed and why healthcare should not be tied in to your employer. It does not provide stability. The millions of people who are seeking unemployment now, who may have had insurance or healthcare coverage through their job, don't have it anymore. There's no stability. There's no peace of mind. And at this very moment, when the major concern is your health, you should not be losing your health care. So Medicare for All provides stability, and it will improve the way of life in the country. And it's the clear choice to improving the current system. I support it, and I ask that you support it too.